Having a medical facility sets us apart from other schools because we can provide immediate access to healthcare services. It also provides parents with a peace of mind because we can quickly respond to emergencies and treat chronic conditions such as asthma. This supports our holistic approach to education by addressing not only the academic needs, but the physical well-being of the students. It also provides parents with a peace of mind because we can quickly respond to emergencies and treat chronic conditions such as asthma.
Hi, my name is Anna Hernandez. I'm the nurse practitioner here at the school clinic at PS28.
My name is Janet Hernado. I am the senior clerk at Montefiore Clinic at PS28.
The benefit for having the school-based health center here at the school for both parents and students is that students can get the care that they need without having to miss school. Their attendance doesn't have to be impacted for something, let's say it's a simple runny nose or allergies, or just something that they don't have to miss the entire day of school for a doctor's visit. It's something that we can take care of and assess here. And the same thing for the parents. They don't have to miss a full days of work for a vaccine visit or for, an earache or a throat pain. That's something that we can handle here within the clinic and take care of, assess. And then if the child needs to go home, then that's something that, we send them home, but otherwise they can stay in school for the day if it's something that is not contagious or something that warrants them to go home for.
We follow the HIPAA guidelines, so the students is protected, so we don't share no information with the school or the teachers.
Generally, there's two types of visits. They're either an appointment, which we've scheduled, which can be a health assessment, an immunization visit. For those, we call the classrooms and we let the teachers know to send the student down for their scheduled appointment. The other type of visit is something we call the same day, which is like a sick visit. The student is generally sent by a teacher or staff member with a pass to the clinic, and the pass will give us their name and what they're in for. Janet will put them into the system, schedule them. They will then see our nurse, Miss Anisha. She will do a set of vitals and get a little bit more background information in terms of what is going on with the child. And lastly, then they come and see me, the nurse practitioner, where I will do an assessment. I will contact the parents to get further history, and from there we'll determine whether they need antibiotics or any kind of medications, if they need further testing for strep or COVID or flu, which we can also do in-house. And then depending on the outcome of the visit, they either go back to class with a pass or they will be picked up by the parent. So we actually have a large migrant population here at this school. So we've been working in coordination with the shelter social work, the school administration, Janet, myself, just coordinating care for them. We've had one family in particular where the child needs a lot of referrals. So between Janet and myself, we've been calling and making these appointments, just helping them navigate the Montefiore system and the healthcare system in order to obtain referrals for this kid so that she can get the full scope of the care that she needs.
And we also help them if they don't have insurance. We refer them to where they could apply for insurance.
We also do their vaccine updates here as well. We do all of their vaccination updates here.
So basically we're a full clinic. So we have the medical, we also have dental, which comes once a week, and then we have a mental health provider who's here 2 days a week. So we're a full clinic.
I help my friends come down to the clinic. If they don't know or if they're sick, I bring them down to the clinic and they follow me down to the clinic. I feel good because whenever I'm sick or I throw up, I go down to the clinic. My name is Zane. My school is PS28 and I'm in first grade and I'm 7 years old.
Having a clinic in my child's school or in a school that my children attend, it makes me more confident or more like I feel okay, because if there's any emergency, the clinic can attend to that kid before they reach out to the parent. So this serves as a protective for all the kids, not for my child alone, but all the kids and as parents as a whole. Oh, having this facility on the side, I know most schools don't or do not have clinics, but we are grateful to have like Montefiore in our school. And I know like it serves as the greatest opportunity for me. Maybe as a dad, I may go to work, my child will rush down here. You know, if there's no clinic, it means they have to call the ambulance service to take these children out of and then take them to the designated hospital that's just closer to them. But we have the clinic here. It serves as the greatest joy for me, not for me alone, but for all the kids here. I would say if parents are enrolling their child, they should take it that it's a safe place, safe environment, because a building without a clinic facility like a school, I don't see it to function very well. Because if you are bringing your child to PS28, that's the greatest opportunity, because we have all the facilities here. We have the clinic staff, everybody is here to work, you know. So it serves as a great opportunity for people to bring in their kids to PS28. 28 is more established. I would say it's more established in District 9, and we are here to see more things. And we have a Montefiore. I know how Montefiore works, even outside the distance, because I work as an EMT, so I know how we work with these clinics and other places. So having this clinic in this school, I would say is the best. And parents shouldn't hesitate to enroll their kids in 28 this coming year, because we have all the facilities here. We have great nurses and practitioners here who take care of their kids, even when they are not on site. When we come to globally, if something happens within any district, we get the alarming. So when it comes to the case, like if there's an outbreak of something and it happens to the school, or it happens to a kid in the school, the first destination point is the clinic. They get here. So they also tell us that, okay, this is the outbreak. So the school works hand in hand with, the clinic, anything that is going on back and forth. So with kids and parents and the school and staff, I think everybody is alert. Both staff are alert, teachers are alert. In case of anything, they just bring the kids down here, and the information is being carried out to the principal for the necessary measures to be taken. I take advantage because anytime my kids have been brought here, I get a feedback note from the clinic. Oh, your daughter was here. This was what we did on your child. I know. So I get a feedback, and even when I take them to their primary doctor, I tell them they were at the school clinic. These were the findings they also said to me. So I think I'm always safe, and I feel comfortable when my kids get here, anytime they are sick.
Awesome.
Okay, by the state law with HIPAA says you can't give any, without the permission of a parent, you can't give the child's medical report to anybody unless I, the parent, or the parent gives the permission to the clinic to be issued out. And if the clinic do something without my permission, it's a violation of law, that which I can press charges against the clinic. So HIPAA law works everywhere.
It makes me feel relieved that the care is on site. I don't have to take her, anywhere, leave work early. Whatever she might need is in the building, and prescriptions are available, referrals are available, and of course the healthcare is available. The care, the attention that the staff provides to each child, and also to add the fact that I don't have to, leave work early. Let's say pick her up and take her to an urgent care. She'll come downstairs, she'll be evaluated, and if a prescription is needed, it's sent to the pharmacy. If we need to speak to them, they're available to speak to. So just the communication is amazing. Well, it's a complete facility. It's an entire facility where vaccinations are provided, where the fact that the doctors can prescribe medication. There's, if the parent needs a referral, they can get a referral. It's a full clinic, and the fact that it's in their school is just it's amazing. For one, they offer their expert advice, as to how to be able to proceed with a child's care after the student leaves the clinic. Again, the communication from the staff and the parents is wonderful. They're always very well with letting parents know. They always go well with letting the parents know that if the child needs anything after they leave the clinic, to please give give them a call. Give the office a call. We had a nurse's station, but nothing like a full, entire, complete clinic. No, and especially affiliated with Montefiore. No. I mean, when people hear Montefiore, they're like, wow, it's great. And then all the services that the clinic offers is just, it's an added bonus. So I love that this is here and available to the children and also available to the parents. When my daughter was a student of the school, she needed medical attention, and she was brought down to the clinic, and she received amazing care. I was immediately notified of my daughter's condition, and I was notified that medication was sent to the pharmacy. I had follow-up calls, just the attention that was provided to my daughter, not only medically, but also from an adult's perspective, to see how she was doing was amazing. I didn't have to leave work. All I had to do is just go to the pharmacy and pick up the medication. And for a working parent, that's a blessing to be able to have that. It's wonderful.
My name is Sofia Ramirez. I'm in 4th grade. My school is PS 28 Mount Hope. My favorite part of having a clinic at the school is that anytime a kid is hurt, is that they could just come down here, talk about it, and get better, instead of having just to keep the pain until the end of the day, just in case their parent can't pick them up or their guardian. I think I remember when I was a bit younger, they did a little rule check, and they said anytime you feel sick or anything, you come down here, report it, or you report it to the teacher so they could give you a pass to go down here. My name is Sofia Ramirez. My school is PS 28 Mount Hope, and I am in 4th grade.
Mi nombre es Lice Ceballos. Mi hijo es Isaac Sebastián Núñez Ceballos y actualmente está en 5º grado. Lo primero es acercándose a la escuela, a esta área, comunicándose con las personas que están aquí para brindar el servicio, que es muy bueno, una atención excelente. Siempre que he tenido la oportunidad de visitar, en mi caso, mi hijo entró ya cuando las clases habían iniciado, pero yo traía mi récord de vacunas y ya simplemente fue traer la documentación y se me explicó cuáles eran los refuerzos que necesitaba el niño. Hice cita, la escuela se comunicó conmigo y le dimos el seguimiento y ya él está al día al momento de hoy. Hasta el momento no he tenido ningún inconveniente porque no es discreta, se comunican directamente conmigo vía telefónica o por escrito. Y en un sobre cerrado llega cualquier información, al igual que cualquier constancia de seguimiento de vacunación. En un seguimiento constante, verificando cuáles son las vacunas, por ejemplo, de refuerzo que están pendientes, y si uno no cumple, por ejemplo, te llaman, te dan seguimiento y te explican la importancia de un reforzamiento de una vacuna para tu niño.
My name is Ms. Rodriguez. I'm the Pupil Accounting Secretary at PS 28. To register your child at the Montessori School is a very fast and easy process. We ask all parents or guardians to fill out a consent form. With this consent form, every child is registered. With this registration, I usually attach their vaccinations or any physical medical forms that the child has, and then then we extend it to the Montefiore clinic. At that point, I either collaborate with Anna, which is our nurse practitioner, or with Janet. So at this point, once I've collected everything from the parents, I go ahead and invite Ms. Janet upstairs to the main office, and this is where I collaborate, or the clinic collaborates from school to clinic. And this is Ms. Janet.
Thank you so much.
So the application is pretty forward. We ask for the students' information, parent information. All documents must be signed. There are a few pages which ask about the child and the family's health history. We ask if they have medical insurance. If they don't, we do referrals from the Montefiore clinic. Again, this page asks about the child's history, if there's anything chronically, or the child has ever been hospitalized, or anything that we should be concerned about, and then family history. And again, once this application is done, the vaccinations or any medical records will go attached to this application. It's like that bridge, right, with the school and the clinic. And I think what really works for us is that we have a good rapport with the clinic. We've even hit like 95% of our students are vaccinated. And we have 609 students. That's one of the things that help us, is that we have the clinic downstairs, and the parents don't have to go outside of the school to get vaccines or anything. Like, it's just easy access for us. It's the rapport that the school has with the clinic and that collaboration that makes it so much better and so much easier.